Have you ever imagined a fully equipped hospital arriving at the doorstep of people who once believed medical care was simply beyond their reach? Imagine waking up before sunrise in a remote village of eastern Burkina Faso and seeing a convoy of military trucks unfolding into operating rooms, diagnostic laboratories, advanced imaging units, and consultation tents. Within just a few hours, families who had spent years living without specialist care suddenly found themselves standing only a few steps away from surgeons, ophthalmologists, dentists, psychologists, and modern medical equipment that many had only heard about on the radio. For thousands of vulnerable citizens, especially internally displaced families and elderly villagers, this was not a dream. It became reality through Burkina Faso's mobile military field hospitals. For decades, many communities faced a painful reality. Serious illnesses often remained untreated because reaching a hospital meant traveling hundreds of kilometers, paying transportation costs they could not afford, and waiting weeks or even months for specialized care. Many simply accepted pain as part of daily life. Others never received a diagnosis at all. But in recent years, a different approach has begun to reshape that reality. Instead of waiting for patients to find hospitals, Burkina Faso introduced a system designed to bring hospitals directly to the people who need them most. Behind this ambitious initiative stands President Ibrahim TRAORE's Presidential Health Initiative, a program that combines military logistics with civilian healthcare to expand access to life-saving medical services. Yet an important question remains. Is this simply an impressive public relations campaign, or does it represent a genuine transformation in how healthcare reaches vulnerable communities across Burkina Faso? Throughout this video, we will explore the origins of these remarkable mobile hospitals, examine their real impact on ordinary families, analyze the achievements already accomplished, and discuss why this model is attracting attention across Africa and beyond. Before we begin this fascinating journey, please subscribe to the channel and join us as we discover how innovation, determination, and compassion are changing lives one community at a time. The story of Burkina Faso's mobile military field hospitals did not begin with a fleet of modern medical trucks. It began with a difficult question that many developing nations continue to face today. How do you deliver specialized healthcare to citizens who live hundreds of kilometers away from major hospitals, especially when insecurity, poverty, and displacement make travel almost impossible? For years, thousands of families in remote communities struggled with this reality. Elderly patients delayed surgery because transportation costs exceeded their monthly income. Children with treatable illnesses waited months before seeing specialists. Internally displaced families often found themselves living far from the healthcare facilities they once depended on. Recognizing these challenges, President Ibrahim TRAORE introduced the Presidential Health Initiative with the goal of bringing essential medical services closer to vulnerable populations rather than expecting vulnerable populations to reach distant hospitals. This vision gradually expanded beyond improving existing medical centers. It introduced a new concept for Burkina Faso's healthcare system: highly mobile hospitals capable of traveling wherever urgent medical needs existed. Whether supporting wounded soldiers near operational areas, assisting overwhelmed regional hospitals, or providing free medical care to displaced civilians, these mobile facilities were designed to respond quickly where traditional healthcare infrastructure faced limitations. The program was never presented as a replacement for permanent hospitals. Instead, it was designed as an additional layer of healthcare capable of filling critical gaps during emergencies or in underserved regions. Engineers, military medical specialists, and healthcare professionals worked together to refine the equipment after initial field exercises. Feedback from surgeons led to improvements in operating tables, diagnostic imaging systems, and medical workflows, ensuring that each deployment became more effective than the last. This willingness to learn from real-world experience distinguished the initiative from projects that simply purchase equipment without adapting it to local conditions. For many observers, this represented more than a medical investment. It reflected a broader philosophy that government services should actively reach citizens wherever they live, especially those who have historically been the hardest to serve. As the first deployments began attracting large numbers of patients, questions about the hospital's capabilities quickly gave way to a much more important question. Could these mobile hospitals truly change lives on a national scale? That answer begins with understanding what is actually inside these remarkable medical units. Picture a hospital that can travel hundreds of kilometers, yet still perform complex surgery, advanced medical imaging, laboratory testing, and emergency treatment without depending on a permanent building. That is precisely what Burkina Faso's mobile military field hospitals were designed to accomplish. Each deployment functions as a complete medical ecosystem rather than a simple convoy of vehicles. Instead of transporting patients over long distances, these hospitals transport specialized healthcare directly to communities where it is needed most, dramatically reducing the time between diagnosis and treatment. Each mobile hospital is built around two highly specialized clinical trucks working together as one integrated medical unit. The first vehicle contains a modern operating theater equipped for major surgical procedures. Inside, surgeons have access to anesthesia equipment, patient monitoring systems, sterilization devices, medical oxygen production, and an operating table that was redesigned after field evaluations to improve flexibility during surgery. These improvements demonstrate that the system continues evolving through practical experience rather than remaining fixed after its initial deployment. The second vehicle serves as a complete diagnostic center. It includes computed tomography imaging, digital radiography, ultrasound equipment, and a laboratory capable of performing essential blood analysis before surgery or emergency treatment. By combining diagnostic technology with laboratory services, doctors can evaluate patients, confirm diagnosis, and prepare treatment plans without transferring individuals to distant hospitals. This integrated approach saves valuable time, especially for patients whose conditions require immediate intervention. Supporting these two medical vehicles are climate-controlled treatment tents, independent electrical generators, oxygen systems, pharmacy supplies, recovery areas, and logistical equipment that allow the hospital to function almost entirely independently from local infrastructure. Even communities with limited electricity or medical facilities can temporarily host advanced healthcare services. Patients move through a streamlined process beginning with registration and consultation, followed by diagnostic testing, specialist evaluation, treatment, surgery when necessary, recovery, and medication distribution before returning home. This remarkable combination of mobility, technology, and organization explains why many observers describe these hospitals as far more than mobile clinics. They represent fully operational medical centers capable of delivering sophisticated healthcare wherever the need is greatest, setting the stage for remarkable stories of recovery and renewed hope. Although the impressive equipment attracts immediate attention, the true strength of Burkina Faso's mobile military field hospitals lies in the wide range of specialized medical services delivered by experienced healthcare professionals. Instead of focusing exclusively on emergency surgery, each deployment brings together specialists from multiple disciplines to address the diverse health challenges facing vulnerable communities. This multidisciplinary approach allows patients to receive comprehensive care in one location, often for the first time in many years. General and specialized surgery remain at the heart of every deployment. Surgeons treat conditions the surgeons treat conditions such as hernias, abdominal disorders, traumatic injuries, urological diseases, and other cases requiring immediate intervention. Once a patient arrives, medical teams conduct examinations, perform laboratory tests and diagnostic imaging, evaluate anesthesia requirements, and prepare for surgery without forcing the patient to travel to another hospital. This coordinated process significantly reduces delays that could worsen medical conditions. Eye care has also become one of the busiest departments during several deployments. Elderly patients suffering from cataracts and children experiencing allergic eye conditions often arrive in large numbers seeking treatment. For many, simply receiving an examination from an ophthalmologist represents an opportunity they have never previously experienced. Dental specialists provide another essential service by treating chronic oral diseases, removing painful growths, and addressing infections that have frequently remained untreated for years because specialist care was unavailable in remote areas. Ear, nose, and throat specialists evaluate hearing problems, throat disorders, and respiratory conditions affecting both children and adults. Meanwhile, one of the most remarkable additions to the program is mental health care. Psychologists and mental health professionals offer counseling, emotional support, and medical treatment for individuals carrying deep psychological wounds caused by displacement, insecurity, and years of uncertainty. Their work recognizes that rebuilding lives requires healing invisible injuries as well as physical illnesses. Every patient follows a carefully organized pathway, beginning with registration, consultation, diagnostic testing, specialist assessment, treatment planning, and, when necessary, surgery, followed by recovery and medication before discharge. This seamless coordination allows the medical teams to serve large numbers of patients efficiently while maintaining professional standards of care. By combining advanced technology with diverse medical expertise, these mobile hospitals demonstrate that quality healthcare is measured not only by modern equipment, but also by the ability to treat the whole person with dignity, compassion, and hope. The true success of Burkina Faso's mobile military field hospitals cannot be measured only by the number of trucks, operating rooms, or sophisticated medical devices. The greatest achievement is found in the lives of ordinary people whose stories reveal what accessible healthcare can mean after years of hardship. Behind every consultation is a family that had nearly lost hope. And behind every successful treatment is a reminder that timely medical care can restore both health and dignity. One of those stories belongs to a school teacher who traveled with his young son to the mobile hospital shortly after hearing it had arrived in Fada Neguma. Determined not to miss the opportunity, they woke before dawn and joined hundreds of others waiting for specialist consultations. The father later explained that every stage of their medical visit, from examination to diagnostic testing, was provided without financial burden. For a family living far from advanced healthcare, this experience represented far more than free treatment. It restored confidence that quality medical services could finally reach people outside major cities. Another memorable patient was an elderly retired baker seeking help for chronic joint pain and declining eyesight. Instead of making several expensive journeys to different hospitals, he completed consultations, diagnostic imaging, and medical evaluations in one location. For older citizens with limited income, eliminating long-distance travel often becomes as important as the treatment itself. Medical teams also encountered patients carrying illnesses for many years, simply because specialists had never visited their communities. Dentists successfully removed painful oral growths that had greatly affected daily life, while ophthalmologists examined numerous elderly people struggling with cataracts and children suffering from persistent eye conditions. Equally significant were individuals receiving psychological support after experiencing displacement, insecurity, and personal loss. Many admitted they had never before spoken with a mental health professional. These personal stories explain why local communities welcomed the arrival of the hospitals with such enthusiasm. They demonstrate that the value of the initiative extends beyond statistics and equipment. Every restored smile, every successful operation, every relieved family, and every patient able to return home with renewed hope transforms the mobile hospitals from an innovative healthcare project into a symbol of compassion. As deployments continue, These individual successes gradually combined into measurable achievements that began attracting attention across Burkina Faso and well beyond its borders. As the mobile military field hospitals expanded their operations, their impact became increasingly visible not only through personal testimonies, but also through measurable achievements. While no single deployment could solve every healthcare challenge facing Burkina Faso, the results demonstrated that bringing advanced medical services directly to underserved communities could significantly improve access to treatment within a short period. What began as an ambitious initiative quickly evolved into a practical healthcare system delivering tangible outcomes where they were needed most. During deployments such as the operation in Fada Negoma, medical teams reported receiving far more patients than initially expected. Consultation areas remained busy throughout the day as families traveled from surrounding villages seeking specialist care. Surgeons, ophthalmologists, dentists, ear, nose, and throat specialists, psychologists, laboratory technicians, and diagnostic imaging professionals worked together to provide continuous medical services. The high attendance revealed not only public confidence in the program, but also the enormous demand for specialized healthcare that had accumulated over many years. Another important achievement involved the growing surgical capability of the mobile hospitals. Medical teams successfully performed procedures ranging from general surgery to complex orthopedic operations that would normally require referral to major hospitals. Patients benefited from rapid diagnosis, laboratory testing, anesthesia evaluation, surgery, and postoperative monitoring within the same mobile medical facility. This integrated system reduced delays that often prevented vulnerable citizens from receiving timely treatment and improved the efficiency of healthcare delivery in remote regions. The initiative also demonstrated an unusual commitment to continuous improvement. Rather than treating the first deployments as final products, medical teams carefully evaluated their experience and recommended practical modifications. Operating tables were redesigned for greater flexibility, diagnostic imaging systems were upgraded to improve workflow, and several technical adjustments were introduced to better match local operating conditions. These refinements reflected a willingness to learn from real-field experience instead of relying solely on initial planning. Perhaps the greatest achievement cannot be expressed through numbers alone. Every successful operation, every restored vision, every patient receiving long-awaited dental care, and every individual finding psychological support represented another family whose future became brighter. Together, these accomplishments strengthened public confidence and encouraged many observers to ask whether this innovative healthcare model might offer valuable lessons not only for Burkina Faso, but for other African nations facing similar challenges. Beyond individual success stories and impressive medical equipment, Burkina Faso's mobile military field hospitals are beginning to influence the country's healthcare system in broader and more lasting ways. Their greatest contribution may not be the number of consultations completed during a single deployment, but their ability to reduce long-standing inequalities in access to medical care by extending specialized healthcare into underserved regions. These hospitals help bridge the gap between urban medical centers and remote communities that have historically received limited attention. One of the most significant benefits is the relief provided to regional hospitals that often struggle with limited personnel and growing numbers of patients. When mobile medical teams arrive, they bring surgeons, specialists, laboratory professionals, diagnostic imaging experts, and essential equipment capable of treating many patients on site. This additional capacity allows local healthcare facilities to focus on patients requiring long-term hospitalization while reducing waiting times for surgical procedures and specialist consultations. The initiative also strengthens cooperation between military and civilian healthcare professionals. Rather than working independently, specialists from different institutions collaborate during deployments, sharing knowledge, experience, and clinical responsibilities. This partnership helps improve professional coordination while ensuring that patients continue receiving appropriate follow-up care after the mobile hospital completes its mission and moves to another location. Another important contribution is the ability to respond rapidly during emergencies. Whether communities are affected by insecurity, natural disasters, disease outbreaks, or sudden increases in displaced populations, mobile hospitals provide a flexible medical response that traditional healthcare infrastructure cannot always deliver quickly. Their independent power supply, diagnostic equipment, operating facilities, and pharmacy services allow them to function even where local resources remain limited. Perhaps the most valuable impact is the renewed confidence many citizens place in public healthcare. Families who once believed advanced medical treatment was permanently beyond their reach now witness qualified specialists arriving in their own communities. That experience strengthens trust not only in the healthcare system, but also in the possibility that public services can respond directly to the needs of ordinary people. While long-term success will depend on continued investment, skilled medical personnel, equipment, maintenance, and transparent evaluation, the early results suggest that these mobile hospitals are becoming far more than temporary medical missions. They are gradually reshaping expectations about how healthcare can reach every corner of Burkina Faso, even under the most difficult circumstances. For President Ibrahim TRAORE, the mobile military field hospitals represent more than a healthcare project. They reflect a governing philosophy that public services should actively reach citizens instead of waiting for citizens to reach public services. This idea has become a central feature of the Presidential Health Initiative, which seeks to reduce the healthcare gap between urban centers and remote communities. Rather than concentrating advanced medical resources inside major cities, the initiative attempts to bring specialist care directly to vulnerable populations, including internally displaced families, elderly citizens, women, children, and communities living far from permanent hospitals. Supporters believe this approach addresses a challenge that has existed for decades. Many people living in isolated regions have struggled to obtain specialized consultations because long journeys, transportation costs, and insecurity prevented them from accessing regional hospitals. By deploying mobile hospitals, equipped with operating rooms, diagnostic imaging, laboratories, and multidisciplinary medical teams, the government hopes to reduce these barriers while improving emergency response for both civilians and members of the armed forces. The initiative has also generated discussion beyond Burkina Faso. Some international observers have questioned whether highly visible projects such as these mobile hospitals contribute to strengthening the public image of the country's leadership. Others have raised concerns about long-term financing, equipment maintenance, staffing levels, and the need for transparent reporting. These are reasonable questions because every major public investment should eventually be measured by sustainable performance, measurable health outcomes, and independent evaluation rather than public enthusiasm alone. Supporters respond that the strongest evidence comes from patients who have finally received specialist treatment close to their homes after years without realistic access to advanced medical care. They argue that successful surgeries, diagnostic services, and mental health support provide tangible results that deserve attention regardless of political debate. Even so, many agree that maintaining public confidence will require continued investment, qualified healthcare professionals, regular maintenance of sophisticated equipment, and transparent publication of operational results. Ultimately, Ibrahim TRAORE's role in this initiative will likely be judged not by the number of mobile hospitals introduced, but by whether the program continues improving healthcare access for vulnerable citizens over many years. Lasting success will depend on consistent implementation, institutional support, and measurable improvements in people's everyday lives. As Burkina Faso's mobile military field hospitals gained international attention, they also became the subject of wider debate. Supporters praised the initiative as an innovative response to long-standing healthcare inequalities, while critics questioned whether such highly visible projects could remain effective over many years. These discussions extend beyond Burkina Faso. Because many African countries face similar challenges involving remote populations, limited medical infrastructure, and shortages of specialized healthcare professionals. One common concern focuses on long-term sustainability. Modern operating rooms, diagnostic scanners, laboratory equipment, and power systems require continuous maintenance, trained technicians, reliable supplies, and stable financial support. Without these elements, even the most advanced mobile hospitals could gradually lose their effectiveness. Others emphasize the importance of transparent reporting, arguing that public confidence grows stronger when governments regularly publish information about patient numbers, medical outcomes, equipment performance, and operational costs. Supporters answer these concerns by pointing to the practical results already observed during deployments. Thousands of vulnerable citizens have gained access to specialist consultations, diagnostic services, surgical procedures, and mental health support that would otherwise have remained unavailable. They argue that these measurable benefits deserve careful consideration alongside broader political discussions. At the same time, many acknowledge that independent evaluation and continuous improvement will strengthen the credibility of the program over time. Beyond the debate itself, Burkina Faso's experience offers valuable lessons for other African nations. Mobile hospitals should not replace permanent healthcare facilities, but complement them by serving isolated communities, emergency situations, and regions with limited specialist services. Success depends on combining modern equipment with skilled healthcare professionals, reliable maintenance systems, sustainable financing, and close cooperation between civilian and military medical teams. Equally important is ensuring that patients continue receiving follow-up care after the mobile units complete their missions. Ultimately, the greatest lesson is that innovation alone cannot transform healthcare. Lasting progress requires commitment, accountability, transparency, and continuous investment in people as well as technology. If these principles remain at the center of future development, mobile medical systems may become an increasingly valuable tool for improving healthcare access across Africa while respecting the unique needs and circumstances of each nation. As we reach the end of this remarkable story, one message stands above every statistic, every medical track, and every successful operation. The greatest value of Burkina Faso's mobile military field hospitals is not simply that they carry advanced technology across difficult terrain. Their greatest achievement is bringing hope to people who once believed quality healthcare would always remain beyond their reach. For countless families, the arrival of these mobile hospitals has demonstrated that distance, poverty, and isolation do not have to determine who receives life-saving medical care. The future of this initiative will not be measured only by the number of hospitals placed on the road. Its lasting success will depend on continued investment in healthcare professionals, proper equipment maintenance, transparent reporting, and strong cooperation between military and civilian medical services. If these foundations remain strong, the program has the potential to become a lasting part of Burkina Faso's healthcare system, rather than a temporary response to extraordinary circumstances. The experience of Burkina Faso may also inspire broader conversations throughout Africa. Countries facing similar geographical and healthcare challenges could study this model while adapting it to their own needs and resources. No single solution fits every nation, but the principle of bringing essential healthcare closer to vulnerable communities offers valuable lessons for many parts of the continent. As Africa News continues to highlight important developments across the continent, discussions surrounding Burkina Faso, Ibrahim TRAORE, the African Union, Mali, Niger, the Sahel, Assimi Goïta, Abdourahmane Tiani, and even relations with France will undoubtedly continue. Political opinions may differ, but improving access to healthcare remains a goal that benefits ordinary families regardless of ideology. Ultimately, the true legacy of this initiative will be judged by healthier communities, restored lives, and greater opportunities for future generations across West Africa. Thank you for watching. If you found this analysis informative and balanced, Please subscribe to the channel, share this video with your family and friends, and let us know your thoughts in the comments below. We look forward to seeing you in our next discussion. We sincerely appreciate your time and support. Every video on this channel is carefully researched, thoughtfully written, and meticulously edited by our dedicated team. We don't rely on automated production or shortcuts to create our content. Every story, every visual, and every detail is crafted with genuine care, passion, and a commitment to bringing you meaningful, high-quality videos.